You're listening to The Social Workers on WCDB Albany.
Welcome to the Social Workers radio show here on WCDB Albany. My name is Eric Hardiman, and I am the co-host of the Social Workers Live with Alyssa Lotmore. Welcome back, Alyssa.
Hi, Eric. Sunny day today. I'm very happy about that.
It's a sunny day here in Albany, and we've got an exciting show lined up. We've got two faculty members with us from the University at Albany School of Social Welfare, and we're excited to have them on. We continue to record remotely. So if you're listening to this on the radio, you'll notice that this is a pre-recorded episode of the Social Workers. And what that means is that we are recording from home via Zoom. And that's the way we've been rolling the last couple of weeks and trying to keep the show as current as possible. And I think today's a really good example, Alyssa, because we've got two faculty members who are going to talk about their response to the COVID-19 situation and talk about how their work has been impacted and talk about some of the exciting things that they've got going on.
Yes, I'm excited. So we have today Dr. Mary McCarthy and Dr. Kate Lawrence, who are both with our National Child Welfare Workforce Institute, otherwise known as NCWI. But Eric can definitely introduce them a lot better than that.
Sure. Our first guest, Mary McCarthy, is a faculty member here at the University at Albany School of Social Welfare. She's the co-principal investigator for the National Child Welfare Workforce Institute, also known as NCWI, funded by the Children's Bureau and director of the Social Work Education Consortium. This is a partnership between the New York State Association of Deans of Schools of Social Work, the New York State Office of Children and Family Services, and commissioners of local departments of social services in New York State. Dr. McCarthy worked in the child welfare field for 11 years, both before and after receiving her MSW from the University at Albany in 1982. She was recently invited to work at Padjadjaran University in Bandung, Indonesia in the fall of 2019, where she completed a Fulbright Specialist Program. Our second guest, and they'll be guests together, so we'll just be having an organic conversation, is Dr. Katherine Lawrence. She's an associate professor here at the University at Albany School of Social Welfare. Dr. Lawrence's scholarship focuses on public human services, particularly in the areas of child welfare and income support. Her most recent research targets two key issues in child welfare organizations that prevent effective, just services for children and families. And those two issues are workforce capacity and racial disparity. She is currently working with the National Child Welfare Workforce Institute to advance this research agenda. She also teaches introductory and advanced policy courses at the School of Social Welfare. So Mary and Kate, welcome to the show. We're excited to have you both here today.
We're glad to be here.
Now,
Thank you, Eric and Alyssa.
So you are both involved with the National Child Welfare Workforce Institute, and for the rest of the show, we'll probably just say NCWI. But can you begin by telling us a little bit more about this program?
Yeah, so I'll take that, Alyssa. This is Mary, and we're really delighted to be here. So the National Child Welfare Workforce Institute, as Eric said, is a collaboration with the Children's Bureau. It's a cooperative agreement. We've been funded since 2008, and our purpose is really to support and build an effective workforce nationwide for child welfare systems. Our primary focus are public and tribal child welfare systems, and then we also work with some voluntary agencies as well. We work across the country. We currently have initiatives, organizational development initiatives underway in 2 counties, 2 states, and 3 tribes. And we generally work with these systems for up to 5 years on a comprehensive workforce development initiatives that also include university partnerships where students are receiving stipends, social work students are receiving stipends to complete their social work degree and commit to working in the field of child welfare. So the work we're going to talk about today are some of the ways we've been thinking about the workforce in the context of the COVID-19 pandemic.
So Mary, when you say the word workforce development, that term may not resonate for all of our listeners. And we have listeners who are community members and listeners who may be tuning into this podcast because they're interested in child welfare issues. But can you sort of explain to a lay audience a bit what you mean by workforce development?
Sure. So child welfare is one of the most challenging jobs there is in the human services field. The workers and supervisors and managers there are responsible for serving families in crisis. They investigate child abuse and neglect reports. They're responsible for foster care and adoption services. So our work is around how to recruit, select, retain, and promote the best people to serve vulnerable children and families in this country. So we work with, we start with directors, managers, and supervisors, but then we work with them around the way they lead and support their capital, their workers in their organization to be the most effective organization available to the community that they're serving.
Great, that's super helpful. Thank you.
Now, how has COVID-19 impacted the child welfare system? I mean, I'm just thinking of all the ways, I was a former school social worker, and the amount of time students would come to me, and whether it's connecting families with services or reporting an issue of abuse or all the things that happen, that students sometimes, families come to teachers and social workers and coaches. How has the whole child welfare system been impacted by the stay-at-home order and this pandemic?
Thanks for that question, Alyssa. I think I really want our listeners to understand that the first thing we need to think about in this are families and children. Because now throughout the country, children are out of school, families are in isolation, there's fear and anxiety about getting sick. Many smaller communities or communities of color have been excessively impacted by the COVID-19 pandemic. So there's more deaths or health crises in these communities. So the first thing we want to think about is the impact on children and families across our country. Then we've been thinking a lot about the staff that go out to investigate child abuse and neglect, to support foster kids in care, to children in residential care. So all these workers are first responders. When a report of abuse or neglect comes in, these workers have to go out. So now they're having to go out. They need to make sure they have appropriate PPE. They need to have digital technology available to them to go into a home and do an investigation. They have to meet people outside to try to keep everyone safe as much as possible. So all the ways that our workers have been doing investigations, serving foster youth and families, everything about that practice has had to change in the context of COVID-19. Some of that means workers feel like they're at risk. They're also homeschooling their own children and doing their jobs. All agencies, public child welfare agencies, have been shut down, so people are not working from the office anymore. They're working from their homes. They have to do supervision virtually. They have to take emergency calls virtually. So all the technology impacts have been affecting this workforce as well. And finally, in voluntary agencies, workers are now there 24 hours a day with children. Youth who used to go for home visits on weekends with their families can no longer go on those home visits. Children who were slated to return home, who had petitions to go back home, the courts shut down, so they're only hearing emergency cases. So all of the ways that children and families would stay connected now has to be done through Zoom or virtually. And children are not allowed out of the residential facilities. There's no more movies or visits to the park. So the workers are there 24/7 with these children, trying to keep them engaged and entertained and feeling loved and cared for, while also trying to engage families.
I'm so glad you talked about that in detail, because this is the part that we don't always hear about on the news. the issues that are going on in the child welfare system. We had another one of our colleagues on, Dr. Sarah Mounts, who talked about her work with foster care, especially in the college students who are in foster care system, and about issues that we really don't talk about, but there's significant impact right now with the coronavirus on these systems. So thank you, Mary, for giving that detailed response about how this is impacting the day-to-day operations for the workforce and for the youth and families who are in these child welfare systems.
I'm hoping Kate can talk to us a little about the tribal situations.
Yes, I certainly can. So as Mary mentioned, we work with 3 tribal communities, and the impact of COVID-19 on the child welfare programs in those communities I think in a way it's really highlighted the best and worst of our human capacity. On the one hand, we've heard from all our tribal partners the extent to which there's really been this instant banding together for the tribal communities, responding very quickly, sometimes more quickly and clearly than the states in which the tribal partners the tribal communities are located, to close down programs, issue stay-at-home guidelines, and really respond right away. Also responding to the community needs. Right away, young people delivering meals to all elders, just all elders, not necessarily do you need this or not, but this is such a critical, important, and valued population, the elders in our community, and figuring out how to make sure that everybody is receiving contact food, whatever they need. There's also examples of the speed with which there's been response to make sure that the child welfare staff have what they need, have technology, figuring out how to make sure that there's internet access in rural areas where there's a real challenge with having the technology for staff to do their job. So it's been very, heartening and lots of bright spots in how the tribal communities have responded in the face of the pandemic. On the not so bright side for tribal communities is the economic impact or the disproportionate impact for those communities. The economic impact is pretty intense, especially in tribes where the income from casinos that are now shut down has helped to support the local community, workers, and the tribal government. In addition, tribes have the historical trauma of genocide through the spread of previous viruses, such as smallpox. So there's, lots of layers of mental health concerns that the tribal services are starting to, are having to also think about.
One of the questions.
I just have one more point.
Yeah, go ahead, Kate. Yeah.
One more on the not so bright side is that, our federal government has been really slow to provide promised funds, and that's has not been helpful.
Yeah, and that's an important addition. Thank you. So I just had a quick question listening to your comments and observations here. One of the things that I think about when I think about this current COVID-19 situation, listening to you, is that it's such a complex situation right now. We have economic impacts, social impacts, family impacts, systems impacts, and certainly then, impacts on children in the child welfare system and on all children, truthfully. And obviously, it seems like some of these systems were more or less prepared for this type of situation. And so I guess I'm wondering if you could talk a little bit about, and I don't have a great question here, but if you could talk a little bit about sort of the complexity of the current situation and the overlapping areas of need. So families, systems, workforce issues, all of these things seem to be separate but yet overlapping and related, if that makes sense.
Yeah, it does. Mary, I could take that one. So I think one of the best ways to give a picture of the layers of complexity is to talk about one of our county partners. And before coming on the radio show, I did touch base with some of our partners to make sure that I had, some of their voices in the front of my mind as I was sharing information today. So I'll just talk about in Erie County, the commissioner there who has her MSW is one of our public agency partners. And she is thinking through all those systems, both the individual families, all the way up to the community context. And in our conversations with her, she's talking about, the infrastructure of the safety net was already really fragile. And this has strained the fragile safety net really to the point of breaking. And for Erie County and in other communities as well, the breaking of the safety net is especially is having a disproportionate impact on communities of color. I mean, I think the pandemic, this is not news to many people, but the pandemic has made it even more clear the extent to which we have significant racial disparities that impact children and families and communities across the nation and in our own backyard. So she is thinking about not just the current crisis, but also what Marie Cannon has talked about as the second wave of crisis, which is going to be the economic impact for that community.
Right. So go ahead, Eric.
No, go ahead. It's fine, Alyssa.
No, I was just thinking about all that you're saying, and you're right. The whole coronavirus, this pandemic, has shown things that social workers have known for a long time about the racial inequities in the healthcare system and with resources and tools. This whole systems issue, it's a systemic problem that's been going on for a long time. So when you're thinking about where do we go from here, how do we possibly reimagine what we can be doing to help get more support and resources to communities to help address some of these issues that we see so clearly. And now that it's brought to light on the more national stage where everyone's talking about it, what can we do to sort of say, here's how we can, address these issues? Social workers need to be at the table to discuss this.
Well, maybe I can start because I think one of the ways that child welfare gets involved in this is the vast majority of cases that are reported to the central registry are for child neglect, which also often has an economic base to it. So I think if what we're seeing is across the board, vast swaths of our communities are going to be in situations where they're laid off, they have no money, they don't have food, should all those cases be reported to child welfare? Or is this now a community problem? And I think for decades, we've really been trying to refocus the neglect side of the child welfare system around what's our community response to children and families. So I think in coming together to respond to a pandemic that's affecting people across the board, how are we rethinking what is child welfare's responsibility and how do we come together as whole communities now to help families and communities heal and recover from this in more comprehensive ways, more comprehensive healthcare, economic availability, job training and preparation, other supports that are needed to keep families whole and healthy.
Part of what I hear you saying, I think, Mary, is that the need for seeing the connections between these various systems and these various phenomena and looking for potential avenues of coordination and collaboration and trying to, maybe this situation, maybe one of the outcomes of this current situation is that as communities that we start to see problems as more interconnected and as more, and therefore solutions as more interconnected rather than seeing them as siloed and separate. Does that make sense?
Beautiful. That's perfect. Yes.
So as we're looking at this, what can we do now to support child welfare workers?
Well, I'm going to start with that. This is Mary, and some things that we can do. As people are seeing articles in the newspaper, we're really encouraging social workers and citizens, community members, leaders in our community to write letters to the editor, to thank child welfare workers as first responders, to hold up voluntary agency staff for the amazing job that they're doing, to really call on state government to not cut resources to these agencies as we emerge from this pandemic, to begin to serve families and communities in the way that Eric described, in a much more holistic way. We would also love to see social workers and communities think about donations to foster care agencies, maybe little treat bags of cookies and other treats that they could drop off for workers and young people that are living in residential treatment facilities. Also, face masks. All these staff and young people and foster parents are going to need face masks as they emerge from the pandemic. One of our alumni from China, one of our doctoral students who graduated, Lei Wu, has sent over 400 masks from China, which we've distributed to foster families in Erie County and in Albany County, and also to the packets that went to the youth from the Liberty Partnership Program. So I think these are ways we can kind of band together to create the resources that are going to be needed as people re-emerge.
And as you know, as we're talking about the workforce, Mary, and we're talking about some of the challenges in the workforce, you mentioned at the beginning that a lot of the some of the work certainly is still in person, but a lot of the work has moved to telehealth models and to remote types of work. Are there new strategies for supporting child welfare workers that are, working remotely for the first time and trying to figure out how to effectively be a remote worker?
Absolutely, Eric. The National Child Welfare Workforce Institute has done a 4-part webinar series on working remotely in child welfare, and that includes attending to worker safety, virtual supervision, that includes team building and worker support, coaching, and then also working in a virtual world. So I think what we're trying to do is get out the best knowledge into the field to help both leaders, supervisors, and frontline workers build the skills they need to work in this new environment.
And I don't want to ask you to look into the future, because I think we're all sort of struggling with that a little bit right now. But I'm curious, just hearing you speak about this, do you think there will be an impact of this remote work down the road? So for instance, once we, if we move beyond this pandemic situation, or at least the current phase of it, do you think that there's going to be a long-term impact from the amount of remote work that's been happening in the child welfare system?
Well, I think there will be one positive impact. We're starting to hear from states and jurisdictions that they may loosen up some of the kind of more strictly bureaucratic employment policies they've had, where people have to be in the office 9 to 5, 5 days a week. Instead, agencies are going, hey, this is really working out. People are working from home. They're getting more work done. They're closer to the clients. Our cost of gas and mileage is going down. We really have the right connections through VPN networks. So I think in some ways it's created the push we needed to get people past that idea that if people are working remotely, we won't be able to control them, to wow, our staff are really fantastic and people are doing a great job, and we're actually seeing practice benefits from having people closer to the work.
Interesting.
So my hope is it shakes up the system a little.
Yeah.
And then I just wanted to give Kate a chance, because we're gathering some data on this as well. So Kate, maybe you could talk about that.
Sure. So my primary role in NICWE is in a research capacity. So we're launching a survey to the workforce with a series of questions about how the COVID-19 changes have affected them. So we should have some initial data early this summer to have some sense from the voices and minds of the workers themselves. How has this had an impact on them?
Well,
and I think
go ahead, Mary.
That we'll try to use that data then to think about that futuring question that Eric asked as well. Yeah. So how can, from what we learned, we really build better child welfare systems?
You know, as our ethos in NICWE, we are really partners with the organizations that we work with. So for them, thinking about how, you know, what they need now and what they are learning could impact what they do in the future to support their workforce. So, you know, all of our thinking is around the workforce. So for example, you know, some child welfare systems have lost workers to the pandemic. And so how can we have a responsive workforce when there's this level of grief and loss? So I'm going to shout out again to some of our fabulous NICWE colleagues, Alexis Howard and Tony Mack, thinking about, you know, really using social work group practice skills to, you know, group practice is a very effective modality. And so bringing this group practice to healing circles with staff who are dealing with not just the challenge of the child welfare work, but the loss and trauma in their own lives and in their own workplaces. You know, there's real strength in the collective, and figuring out how to bring that and bring that to the agencies we're working with and help support them, but then also learn from that, how can we use these kinds of tools as we move forward?
And I would imagine, you know, I think that's a really innovative and exciting idea, Kate. And I would imagine that it would have some relevance and resonance for other areas of work too. So I'm thinking of healthcare workers more generally, and certainly, you know, the workforce that's working in nursing homes and aging care facilities, who are certainly dealing with a different level of risk due to the COVID-19 situation, and possibly more loss, and certainly the loss of clients and the loss of family members or significant others. And so I wonder if that idea that you're talking about of a group-based intervention that would help the workforce who is dealing with grief and loss, really could have some relevance in other types of workforces as well.
Yeah, I think it really could. Yeah, there's a lot of opportunity to, you know, share these innovations across the areas of social work practice. And I can't remember if I said this or not, but one of the things that has, in working with Alexis Howard, has helped ground me is, her focus on whatever we do, we have to lead as humans, stay grounded in our humanity. And, this, you were asking about, how, Alyssa, I think you were asking about how do we move forward from this? How do we make the change we want to see? I think that's really how we move forward. We need to make sure that we are staying grounded in our humanity as we look at something that is so hard and so devastating. Making sure that we bring both our mind and our hearts to how we move forward.
Well, it certainly sounds like the work that you're both doing is exemplary and is really demonstrating exactly what you're talking about, Kate, using research, using, empirical supports and using the literature and using what we know about what works, also combining that with new and innovative ideas and bringing the personal and the sort of heart to it as well. For a workforce, I think is really admirable. So thank you for the work that you're both doing.
And it is valuable because I remember just through my MSW internship years ago when I was in a youth setting, child welfare setting, and I remember we couldn't get business cards for about 6 months because the turnover rate was so high. They wanted to make sure we were staying. And the interactions with the youth, they were afraid that people were going to leave because that's what they were so used to, this turnover. They weren't able to build rapport. So the fact that you are trying to make sure that the workforce is able to, stay at their job, that the needs are being met, they are essential workers. How are we helping them with navigate this whole process? It's such a valuable thing, not only for the workers, but for the youth and the families, the whole agency environment, that whole culture, it changes the whole atmosphere. So I want to thank you for that.
So if you've just if you've just tuned in, we've been talking with two faculty members from the UAlbany School of Social Welfare, Dr. Mary McCarthy and Dr. Kate Lawrence, both of whom are involved with the National Child Welfare Workforce Institute. And we've had a great conversation. It's been really wonderful hearing about the work you're doing, hearing about the myriad of challenges, both systemic, organizational, population-based challenges, societal-based challenges, governmental-based challenges. There's a lot of challenge right now, but I also hear in your words a lot of opportunity. And I think that's one of the key goals right now is how do we transform this time of challenge into one of opportunity and one of growth. So we want to thank you for being on the show. And if you have any final comments, things you'd like to share with listeners, please feel free.
Well, you can follow the work of NCWE through Twitter, Facebook, and LinkedIn. And actually go to the NCWE website, www.ncwwi.org, where we have lots of new resources, always evolving. I'm going to give a shout out to my colleague, Sharon Kohler, who is a graduate of our MSW program and really helps to manage the knowledge that NCWE is developing. People can access webinars, access information about virtually supporting the workforce, our racial equity agenda, and lots of information about child welfare workforce efforts.
I have seen that on the Facebook page and the LinkedIn page. And I like that you're sharing that. It's not something this is our research, this is our information, and we're hiding it. Having the webinars be available to individuals, you have great infographics and other materials for the public and other organizations to see. So thank you for that.
So, as a last quick question, Mary, I'm curious, would you have any words to say for folks that are listening and possibly not involved in the social welfare, social work field, but are considering coming back to school and getting an education? Why would someone want to become a social worker now in this challenging time, and particularly if they're interested in child welfare issues? I'd love to hear your thoughts on and words of encouragement possibly for people that are considering that as an option.
Oh gosh, Eric, thanks for that softball question, because I think there are probably 100,000 reasons why, if you're interested in human services, if your heart has been touched by the stories that we've been hearing about the impact of the coronavirus and the pandemic on our worldwide communities, why you might want to choose social work as a career. I think at this point in history, as we emerge from this crisis, there will be no end to the opportunities that are available to people who are trained as social workers, from contact tracers to people that will help families deal with the grief of the loss of a loved one. We've had our whole grieving process interrupted by the pandemic worldwide, to helping families and young children re-engage in school, to helping families recover from homeschooling their children, to really reaching out into communities. How are communities going to reorganize themselves as a result of the pandemic? If you're interested in community work, you can do that. If you're interested in health work. You can work in a hospital or healthcare center. If you're interested in grief and loss, you can do that both in religious institutions as well as communities and healthcare settings. I think there's going to be no end to the ways that social workers will be able to contribute to rebuilding the health and wellness of our country. So anyone interested in the field of social work, or if you even think you might be interested, I would encourage you to get a hold of the School of Social Welfare through our help desk and come and learn more about the profession, or through our website, www.albany.edu/SSW, and learn about what the profession has to offer. We're going to need millions of social workers across the globe as we heal from the pandemic.
Great. Thank you for those words of encouragement, Mary. Part of what Alyssa and I try to do with the Social Workers radio show, with this show, is to really also do some education of the public out there, that not everybody knows what social work is, and not everybody knows what social workers do. And folks may be thinking about social work in new ways as a result of this current situation, and thinking about, maybe this is a time when I get out of the rat race and get back into helping my community. Maybe this is a time when I have a career change. Maybe this is a time when I want to learn a new set of skills, and I have something to offer. And so I think your words of encouragement are really wonderful right now, as we kind of think about how do we spread the message of social work in a way that really helps build our community. So you've been listening to the social workers here on WCDB Albany, and we again want to thank Dr. Mary McCarthy and Dr. Kate Lawrence. Thank you both so much for being on our show.
You're welcome. It's been great.
Thanks, Alyssa and Eric. You guys ask really good questions.
So Alyssa, let's bring listeners up to date on the social workers. We, as I said at the beginning, we have been continuing the show recently. We decided to keep the show going full strength right now because there's such a need for information, and people are home and possibly listening to the radio more, possibly listening to podcasts more, and we really want to increase that engagement and keep the conversation going. So I know we'll have more things lined up over the summer and into the fall. And, maybe if you could talk a little bit about that, and about how folks might find out more about this show, The Social Workers.
We have a lot of amazing shows that have been lined up these past few weeks during this coronavirus outbreak, because we want to make sure that we are current and individuals know how our social work faculty, alumni, and even students have been impacted by this, and how it's changing the work that they're doing in the social work field. We have had someone from IPH come on, the interfaith, formerly known as Interfaith Partnership for the Homeless, talking about how the homeless population has been impacted by this. We had the Greg Olson from the New York State Office for the Aging come on, talking about how do we care for seniors during this time? How do we protect our loved ones? And even how do we socially engage? He talked about this animatronic pet program that individuals can have, these robotic pets to engage them socially and to help, have that social interaction. We have had Samantha Fletcher come on. She's an alum. She is the current director of the National Association for Social Workers New York State chapter. And she talks about what the agency is doing to engage its members during this time, and how do we still move forward with our social work agenda that we have to make sure for social justice. How do we address those needs for advocacy and continue that? How do we still engage with other social workers and problem solve and share resources? So there is a lot that we have been covering, and that we want to continue to cover throughout the summer to share that information with you. And it sort of covers how broad the social work profession is, all the different areas that we are working on, that we work in, from hospital settings to homeless shelters to schools. I mean, the list goes on. So we hope that you'll tune in. Again, we're always available. You can listen to our shows on the Social Workers Radio Talk Show.simplecast.com. We're also on iTunes, and you can follow us. We're very active on Twitter. Our handle is @SocialWorkersFM. So that's how you follow us, and please do.
And we encourage listeners to check out archived episodes. If you heard any of those, if you were unable to hear any of those episodes that Alyssa just talked about recently, they're all available for listening and checking out. So we hope you'll explore. We've got years and years going back of archives of episodes of this show. So please do listen if you're interested. Go ahead, Alyssa.
Nope, I just want to thank Mary and Kate again, and we'll be back.
Thanks for listening to The Social Workers on WCDB Albany.
You're listening to The Social Workers on WCDB Albany.